So good afternoon, everyone. Again, we are joined today by Dr. Curry Winchell to go over the COVID-19 vaccine and some FAQs that have been submitted to us previously. Just a brief overview of Dr. Curry Winchell's past experience. She obtained her medical degree at Ross University and completed her residency at the University of Nevada, Reno School of Medicine under Family Medicine and graduated in 2015. She's board certified and currently both a practicing provider and director of St. Mary's Urgent Care Clinics, and this is up in Reno, Nevada. She has also served as an assistant medical examiner for Washoe County Child Protective Services. Prior to becoming a physician, Dr. Curry Winchell received a master's degree in physician assistant studies from Marietta, Ohio. In addition to her clinical work, Dr. Curry Winchell is a member of the Nevada Academy of Family Physicians, the American Academy of Family Physicians, and a board member of the Washoe County Medical Society. She also participated in USA Today's One Nation Healthcare Panel in 2016. With a passion and dedication to caring for and improving her community, she is an active member of the Young Professionals Network, being awarded one of 2018's top 20 under 40 brightest leaders in the Reno Tahoe area. She was also named Sierra Nevada top 20 most powerful women in 2019. She and her husband enjoy life in Reno Tahoe area with their 2 young girls. All right, so getting started into this very basic information, again, all of this follow-up information will live in immunizenevada.org. And going straight into the very basic questions. What vaccines are currently available within the United States? Dr. Curry Winchell, if you have just very basic information regarding the Moderna, the Pfizer, in the next slide, we'll cover a few more of those detailed questions regarding the Johnson & Johnson vaccine.
Absolutely. First, I want to say, David, and to the entire Immunize Nevada team, thank you for having me. It's a pleasure to be able to talk about this information and try to, provide details and things that will really help everybody on the call provide this information to the people that you work with. So we do know that we have Moderna, Pfizer, and then J&J or Janssen. And so the Moderna and Pfizer vaccine are messenger RNA vaccines. And then the Johnson Johnson is of a different format. And so when we look at each vaccine, the one thing that I often hear from patients, which vaccine is the best? And I tell them it's the first one that you can get. And so they have different efficacy levels as far as percentage. However, the main thing to remember about each vaccine is it can hopefully prevent, hospitalization and death. And so I always would like to remind people not to worry about if one has a higher percentage versus the other. It's all about staying healthy and hopefully preventing hospitalization and death. As you can see on the slide, the Moderna, it's 28 days apart, and then Pfizer is 21 days apart. For Janssen & Janssen, it's a one shot, and then shortly 2 weeks after, that's when you've kind of achieved that level of immunity.
Perfect. Thank you, Dr. Curry Winchell. And I'm glad that you hit on that subject there that, I don't believe any vaccine has 100% efficacy, right? Even with vaccines that aren't regarding COVID, we may have really high percentages. But what we've heard from other providers and from yourself is that rate of hospitalization and severe illness really drops down sharply. So even if you do possibly get sick, the chances of you being in the hospital or being gravely ill just drop tremendously.
Absolutely.
Perfect. Now this slide does have a lot of information about it. I know the upper half you've already discussed in terms of the Johnson & Johnson vaccine and how it's just one dose. But if you could go a little bit into the recent Johnson & Johnson vaccine pause, being able to touch on what sparked the pause, and then what the new guidance is moving forward that you have received as a medical provider, how you recommend the vaccine and maybe what to look out for after receiving it.
So what I like to start off with, especially when we talk about the Janssen vaccine, this is an example of the credibility we can feel within the public health system. when the vaccine started to roll out, we talked about that we were going to have a checks and balance. And if we ever found anything that seemed to be out of the normal, that there would be a pause or the ability to, take a look further and make sure we're not harming the general public. And so we recently received this pause, and that was due to the findings of blood clots that were occurring in the brain. And so it's unfortunate the amount of cases that have transpired, and each life is important. So it's not to discount that. One thing I like to talk about is when you look at how many people have been vaccinated versus those very unfortunate outcomes, that risk to benefit ratio is quite low. And so that's something to think about when you're thinking about, should I, move forward with the Johnson & Johnson vaccine? The things I like to talk to people about are, we know with all the vaccines, body aches, a fever, as well as general fatigue are common. However, if you're experiencing a severe headache, confusion, any sort of thing like that, that is when you definitely want to reach out to your healthcare provider. I also don't want to forget abdominal pain, because that has also been something that people have presented. And when you are talking to, different people in the community, remind them about the vsafe.gov. And I think that's an important tool that we all have. And that allows the patient to really have, some control in how they're feeling, as well as the ability to seek help. And so those are the biggest things that I'm trying to put out there in respect to the Johnson & Johnson vaccine. And when we look at risk factors overall with blood clots, we know that they're common with certain medications, as well as there's a risk if you're on, a plane for a period of time. So when we discuss blood clots, it's important that we really take in all the variables and how often they can occur just in the general population.
Perfect. That's good to know. And Dr. Curry Winchell, if you can maybe elaborate, I know that I've seen some of the science before, and I think just getting your reassurance, when you're comparing the very small possibility of blood clots caused by the Janssen or the Johnson & Johnson vaccine, the possibility of blood clots occurring as a side effect of COVID are much higher, correct? If you contract COVID, that is one of the side effects.
That is correct, David. Thank you for bringing that up. And so we do know if you contract COVID-19, there is an increased risk of what we call where your blood gets really thick. The term is hypercoagulability. And so that risk alone is higher than the percentage we're seeing with the Johnson & Johnson vaccine.
Perfect. That's good to know. And just a follow-up question, the more severe symptoms that you had discussed, how far out after receiving the vaccine should that be a cause to reach out to a medical provider? When will those start to show up?
So we really don't know how soon or how late, those symptoms could possibly show. And that's why I'm really glad that the government has put, certain things in place as far as the vsafe.gov to really check in with people. And I am passionate about people being their own health advocate. If it's day 1 or day 48 and you are experiencing a symptom that you're concerned about, reach out and ask and talk to your healthcare provider.
Okay. Perfect. Thank you for that information. So we did go over some of those more severe side effects, but getting vaccinated, we do know that some of those mild side effects exist. Will you go over some of them? I know I listed them here on the screen, and why do we get those? And that's a good thing, right? It's a good thing that we're getting mild side effects. Why is that?
Absolutely. So I know there's a lot of, concern about, I don't want to fall ill after getting the vaccine. And so the side effects that you see right here, of course, soreness, mild chills, body aches are very common. And I always like to give an example of something that I can understand. So I've been a dancer my whole life, ballet and jazz. And so the best way that I can describe this is it's a dress rehearsal for your body if it was to ever come into contact with COVID-19. So when you're experiencing chills, fatigue, it's your body's way of arming itself if it was to ever come into contact. And so although the symptoms are not, something that we want to experience, the important thing to remember is they're very temporary, and it's your body's way of protecting itself. So that's a good way to kind of find that fit with whoever you're working with on something that they can really embrace and understand, and really channel that to compare side effects and why it's happening.
Gotcha, perfect. And when it comes to these mild side effects, these can be expected between any of the three vaccines, right? I know we don't want to hear, or sometimes we hear, excuse me, well, I'd rather get this one because my friend didn't have side effects with that one, I'd rather, but the side effects are mild, and they could come from any of the three, right? Not preference over one or the other.
Absolutely. And that goes back to, the discussion of it's your body's way of arming itself. So with any of the vaccines, because it's a way to protect yourself, these side effects could potentially occur. But again, they're fleeting, and it should provide a level of just comfort that you are now protecting yourself in hopes of not getting COVID-19.
Gotcha. Perfect. Perfect. Thank you for that explanation there. So we hear this question a lot, and we, as Immunize Nevada and working with different frontline staff, sometimes people have a negative experience with those side effects with that first dose. Why do we need that second dose?
So the second dose is very important because when we talk about all of the clinical trials that actually occurred, they were based on receiving 2 doses. And so when we talk about the efficacy or how well a vaccine can work, that is based on the data of receiving 2 shots. Now, of course, when we talk about the J&J, that range is based on 1 shot. But if you receive something like Moderna or Pfizer, it's very important to go ahead and get that second shot. You want to be able to provide the best protection, not only for yourself, but for your family.
Gotcha. Perfect. Perfect. And then just reiterating again with this question, the vaccine that's best is that vaccine that is offered, that you have easiest access to, and is closest to you as well.
Absolutely. If you have the opportunity to get the vaccine, please please embrace that, because it's a gamble. And I always like to talk about, because we live in Nevada, you have no idea if you were to get COVID-19, will you receive mild symptoms? Will you receive severe symptoms? And so the ability to have the possibility of protecting yourself is huge. And another thing I like to talk about, because people are concerned, they state, it's not 100%, like you mentioned, David, not all of them are, but we do know if you've received the vaccine and unfortunately get COVID-19, your symptoms are going to be milder. You're not going to end up in the hospital. And so that's something to take into consideration.
Perfect, perfect. And just some information that we've received from Immunize Nevada as we kind of start moving forward with the planning of community clinics. I know that the recommendation has been made to, when setting up these clinics, to allow for more than one possible choice of vaccine, just in case if people are hesitant against the Johnson, we can say that's fine. We have another option that you can still receive, still has high efficacy, and kind of helps relieve some of that tension there. So I think moving forward, that'll kind of, if it's difficult to kind of combat some of that messaging that has been put out regarding Johnson, there's still another option for community members to still get vaccinated.
Absolutely. We actually, in our recent Faith in Healthcare, we provided, one day we did Janssen & Janssen, and then a couple of days later we did Moderna. But I think the opportunity to have pods that really offer a choice, as well as a section where people can ask their questions, I think will help us in the long run be more impactful and to more people.
That's perfect. All right, we have a few questions queued up here. Before I move on to those questions, I'll be sharing this information again, but For more information, there is nvcovidfighter.org, where we have all of our content in English and Spanish. And if you prefer to speak to someone over the phone, then we have the statewide 1-800-401-0946 number. And if you have any questions regarding vaccines, where a local clinic is, or if you need to access a healthcare provider that you can ask questions to, you can email us at covidvaxhelp@immunizednevada.org. Very quickly, I'm going to stop sharing my screen here. And then Dr. Curry Winchell, I will go ahead and go over some of these questions.
Okay.
Perfect. All right. A common question that we get, especially when serving different populations, is what if I have any underlying health conditions? For example, like diabetes, and I take regular medication. Is it okay to get the vaccine? Is there any kind of harmful mixture or any guidance when receiving the vaccine and taking a recommended medication?
Now, that is a great question. If you do have any underlying health conditions, it's really important to actually get the vaccine because you are at an increased risk of having complications from COVID-19. And the only underlying health condition that I really recommend people to discuss is Guillain-Barré. And that is a disorder that really needs to have a discussion with your doctor to make sure that's the right fit. But overall, this vaccine is, a protection in hopes that you don't get COVID-19 and actually experience the complications that can be worse when you have underlying health conditions.
Awesome. Perfect. That's good to know. And thank you for bringing that up, Dr. Curry Winchell. I know that when we promote vaccines, we really want to reach herd immunity. And one of those factors is for those who can't get vaccinated, right, or may have the medical recommendation to not to, we're doing our part to protect them just because they may not be able to. So thank you for bringing that up. Another question that we get is, I already got COVID. Why do I need to get the vaccine?
This is a common question that I receive as well. So if you have already contracted COVID-19, the issue is we're not sure how many antibodies, which are our level of protection, are still in your system. And so some patients have a high level and some actually have a low level. And so without knowing what that true state is, it really increases your risk for reinfection versus getting the vaccine that allows your body to have a more steady state of protection. So that's why we recommend it.
Gotcha. Perfect. That's good to know. Now, I do have a few questions queued up here, but I know with the attendees of this webinar, I wasn't sure if anyone would like to unmute themselves or if you would like to type a question into the chat. We can take one of those questions and feel free to do so. We'll give it a couple of seconds. Dr. Curry Winchell, I know that we'll let you go right before, a few minutes before 12:30. But while we're getting some of those questions in, I'll kind of just keep going through the queue. So anyone, please feel free to either just put something in the chat box or you can unmute yourself. The third question here is, can the vaccine give me COVID?
So it cannot. The vaccine's goal is to protect you from coronavirus. And so that's why I like to talk about those symptoms that you're experiencing. It's your body's way of protecting itself. So that vaccine is a gift of protection. It's not to expose you to the coronavirus.
Yeah. And that is kind of one of the benefits, right, of this mRNA technology when it comes to the other two, where showing the immune system how to identify a key protein and not necessarily including the virus itself or a piece of the virus itself in the vaccine.
Absolutely. It's like a recipe card is how I like to give the example. And it's a recipe that your body is receiving so it knows how to fight the coronavirus.
Perfect. Perfect. This question here, we seem to get a lot, and I know that there's different answers, and normally, in my experience, we just try to keep the conversation going and not try to feed too into it because it can kind of be a conspiracy theory. But will the vaccines impact fertility? Will they impact, the ability to have a child in the future?
So the way I like to approach this question is, When we talk about coronavirus, just getting the virus, we know that there are so many complications associated with it. And so if you were to get pregnant and you ended up getting coronavirus, the complications could be severe. And so the ability to protect yourself, as well as the knowledge that we have that there isn't any sort of correlation with the ability to get pregnant, really provides reassurance for me. And I think everybody has to make their own informed decision on what's best for themselves and their family, but it's something to really think about. The other thing we're not sure about is if you were to get coronavirus and you're pregnant, we're not sure what complications you could actually pass along to your child. And so that's something to think about as far as a level of protection that you could go into your pregnancy with.
Perfect, perfect. That does provide a good follow-up here, and I think this may be the last question unless someone types one in. But I know that when it comes to community members who ask us, I'm pregnant, can I get the vaccine? Our guidance from the CDC is to speak with a medical provider. And I know that every pregnancy is totally different. We can't always provide a kind of a blunt statement for yes or no, but is there any guidance that you can give for when we receive those questions when someone may be pregnant and interested in getting vaccinated?
I recommend exactly what you guys are saying. Have that conversation with your OB, your doula, your midwife, whoever is your healthcare advocate, and discuss your concerns and really talk about your underlying health conditions, the risk if you were to get COVID-19 while being pregnant. I think all of those topics have to be acknowledged and really discussed to make the best decision for you and your baby.
That's really good. Well, all right, Dr. Curry Winchell, I don't see any more questions coming in, and that's all that we had in the queue. Maybe we'll give it a second or two if someone wants to unmute themselves. And while they do that, I just want to say thank you so much again. This has been recorded so that we can share it with other community partners and members. And if the need is there again, we'll be sure to reach out and get some more questions answered from you.
Thank you both. Thank you for having me. And please let me know if there's anything else I can participate in. I love this work and I appreciate it.